Everyone have a good day so far. I want to keep my presentation a little bit short and sweet so that everyone is ready for lunch. I know some people, they are ready to take lunch already, and I am ready as well. So, yeah. So today we're going to talk a little bit about social determinants, potential solution, and what we currently do. My name is Tu, and I am a program manager at BPSOS, Center for Community Advancement. At BPSOS, we do a lot of services for the Vietnamese immigrants. We have like ESL classes, citizenship classes, and then we expand our services to mental health, advocacy, having like training for providers, and we also have the other social services, vaccination, and also other like public matters as well. So there are four social determinants that we see very commonly among Vietnamese immigrants. We know that there are more than that. It's not only four, but those four that we see that been like a trend for the Vietnamese population. Income is a big thing, right? So according to the study by the Asian American Psychological Association, Vietnamese American with lower household income tend to have are less likely to utilize mental health services because they are busy to work overtime, they are busy to feed their family, to have like a roof over their head, and they worry about other stuff, housing, family matters, and also like food as well. Educational level is another factor. The research showed that higher educational attainment is associated with greater mental health literacy, and they are more likely to seek help because they kind of know a little bit about like signs and symptoms. If they have like college degree, they may know a little bit about like resources, where to seek mental health services. Those who don't have like like that higher level that of education are a little bit hesitant to seek mental health help. They may not know about the term mental health even. They thought of it as something that's really bad and that they shouldn't have. And according to like the Vietnamese culture, that's something that you shouldn't have or shouldn't say, shouldn't share to the public. So therefore, those who have an educational level who are a little bit like higher tend to know about mental health resources. And the next thing, very, very common, is cultural backgrounds. Cultural backgrounds relate a little bit to stigma, and stigma, according to the Vietnamese culture, people who have mental health think that they may be punished from the past life. It ties a little bit to like religion and also Confucianism teachings. They may not like share their problem out to the public, and they have like the tendency of keeping everything for themselves. Within the family, they don't want to share it as well because it's considered as a sign of being weak. You may hear it a lot, but for a Vietnamese family, they really don't want to share and they really don't want to talk about mental health because to them, mental health term is something really, really new. And in the Vietnamese culture is often perceived as a family matter rather than individual concern as well. And something that I want to emphasize today is language success. Language barriers are very, very significant, and it may be like an obstacle to accessing mental health services among like Vietnamese immigrants and also other populations as well. Research indicated that limited English proficiency is associated with lower utilization of healthcare services. It come with like not wanting to communicate with the providers. They are unable to share. They are unable to communicate it through. They're unable to talk about their feelings. And that's the big thing. How can you assess mental health without actually telling what you feel or like how you feel, right? You may not be a little bit like hesitant to talk about that because you don't have like a terminology or you don't have, like the capacity to communicate with the providers, to communicate with someone who need help with. Next, please. Just want to share a little bit about like what the community say. We have like focus groups, and we had like 52% expressed wanting to seek professional help for mental health, but 41% feels that language barrier and awareness for culture prevents them from seeking help. Next, please. And then there are two potential solutions that everyone knows, but not like it can be implemented like right away. Is the need of language providers and the cultural competency. Next, please. So at BPSOS, what we're doing is we're trying to increase the future workforce. We're trying to bring the fire, the passion to the younger generation because they are the ones who are leading the mental health and the healthcare industry in the future. We're having the volunteer program, internship program, and also AmeriCorps program that we are trying to teach people the cultural competency. We're trying to teach people how to approach the Vietnamese community or other population in a culturally competent manners. And we also host like cultural competency training where we provide current future providers knowledge and skills to practice mental care and treatment in the culturally competent manner. We also increase the confidence of community members and clients in assessing mental health services by fostering positive experience with providers as well. And in order to introduce people to mental health care, we often address other problems first. Housing services, we address the basic needs. We refer people to social services where we address like a necessity in life, like food, physical health, and other matters. And then we refer people to indirect services, right? So we try to increase the awareness and knowledge of mental health to overcome stigma. And we refer people to direct services after, when they are a little bit more confident.